بسم الله الرحمن الرحيم. A discussion will be held on Zagazig next Saturday, inshallah, where we will discuss the effect of giving dexmedetomidine and ketamine to patient 10 minutes before the end of the surgery to minimize the effect of emergency agitation after adenotonsillectomy. This study was encountering 21 patients in each three groups. The first group received, which was the control, only 10 milliliters of saline before the end of the surgery by 10 minutes. The second one was giving dexmedetomidine and ketamine. And the third one had a drug made of propofol and ketamine. The study, of course, resulted in an conclusion where we proved that the combination of dexmedetomidine and ketamine definitely decreased the incidence of emergency agitations in kids after adenotonsillectomy. We can see from the first slide the agitated patient, and also we can see the vial which was manufactured by the dexmedetomidine, which is an alpha-2 stimulant, which was manufactured by an American company. This vial, as you can see, it contains 5 milligrams per 10 milliliter. Of course, we dilute it so that we can adjust the amount given to the kids. My colleague was Lebanese from Libya, and he used instead of the vial special ampoules. The first slide shows that there's whenever I use sevoflurane or hallucine without surgery, definitely prove that the incidence of emergency delirium or agitation is more in the sevoflurane group. And another study was where it was found that only 15% of the hallucine giving patients had only emergency agitations in comparison to the sevoflurane group, where the incidence was 50%. Patient giving midazolam before the beginning of the surgery definitely increases by 9-fold the incidence of emergency agitation after surgery. Of course, the possible cause of emergency agitations includes, of course, when the baby is waking in unfamiliar settings, and there is pain, of course, stress during induction, hypoxemia, airway obstruction, noisy environment, anesthesia duration, child's personality, pre-medication and type of anesthesia. All these are factors that may affect the incidence of emergency agitation. Of course, it was shown that there was a prolonged episode of agitation lasting up to two days. So it is a problem that we must definitely resolve. Of course, it was shown that there is an imbalance of the neurotransmitters such as serotonin and dopamine and acetylcholine, which plays an important factor in the incidence of the agitation. The three inhalation famous inhalation anesthetics showed that they have an electroencephalographic changes which is present with the incidence of emergency agitation, which does not occur with hallucine. It was found that there is an elevating of lactate and glucose concentration in the partial parietal cortex due to sevoflurane anesthesia, which may play a role in the elliptiformic incidence or what happens in the EEG during sevoflurane anesthesia. Studies of course showed although that changes in the brain network connectivity during induction and the end of the surgery which make correlate the incidence of sevoflurane inducing emergency agitation. As you can see, the thalamocortical conductivity and the reticular formation are preserved, but however, delayed recovery of impaired functional ability of subcortical regular system were affected, which may contribute to the defect and the occurrence of emergency agitation. Of course, to prevent emergency agitation, we have a pharmacological methods. As you can see, different types of drugs, including magnesium, Nivopam, and of course, dexamethasone, which is proved to be the best, and of course, multimodal analgesia and so forth. Non-pharmacological methods, of course, we must inform the patients and his relatives, of course, about what will happen, so that we may minimize the effect. And of course, we must remove indwelling invasive ascasters before at the end of surgery, so that we will minimize the effect, and show to the patients what are the possibilities that may occur at the end of the surgery. Of course, Italian method was using a method where we used to take the kids to have a look about the hospital and what's going on the operation, that they explain to them that everything is going fine and nothing will happen, so to minimize the occurrence as a non-pharmacological method. Of course, we have to have a differential diagnosis whenever we have a kid getting up of anesthesia and he's irritable. We must put in our mind the other factors that we may mislead us, as increased intracranial pressure, bladder distension, upper airway obstruction, hypo or hyperglycemia, hypotension, hypoxia, and hypercarbia. There is another monitors, one made in France, and one in Lilly, and one made in Germany, to adjust the sevoflurane and Diprivan during the surgery, so that they will minimize the incidence of emergency agitation. Medullary anesthesia nociceptive index, ANI monitor. It is a computer-based ECG monitor, to study the heart rate variability for adequate analgesia. See, so I must assure there is an adequate analgesia by such a monitor. Of course, it evaluates the heart rate by a special monitor where there are electrodes placed on the patient's chest. The other monitor, which is called narco trend EEG monitor, is trying to adjust, of course, the brain activity to the normal sleeping by adjusting so that we will not give too much sevoflurane during the operation. Of course, it was first discovered in 1960, and the problem that it may induce post-operative what we call a maladaptive behavior changes, where we find the kids having sleep disturbance, separation, and anxiety. Whenever they are separated, they feel anxiety, and we have eating disturbance. This is why we must consider it as a problem, which may last for up to 2 weeks. The nice thing about the differentiation between this emergency agitation, whether it's due to pain or not pain, by using what we make an eye contacting of the patient with the health carrier. You see, so that whenever the patient is in agitation and he doesn't look to the health carrier, we may put in our mind it is an emergency agitation. You see, on the other hand, if he makes a good contact with the eye of the health carrier, during this agitation, it may so that the patient is trying to distract the attention of the carrier. So we can consider it as a cause of a pain, not an emergency agitation. Intranasal or dexamethasone was also used, and we use also Catalar, and there are special drops. We will show it later on in the graph. Of course, gabapentin was used also to decrease the incidence. Acupuncture in Japan, where they use what we call heart 7 acupuncture site with a peripheral nerve stimulator, a special part on the heart to decrease the incidence of emergency agitation. This high incidence, of course, is correlated to barbiturates and scopolamine, and it was also encountered in the past where we use cyclopropane and ether. Of course, we have another way to adjust this agitation, but by what we call the face leg activity cry consolability. Consolability means that the patient is comfort. This method was compared with the pediatric emergency agitation, and they found that there is a difficulty to correlate the agitation to this method of scoring. Of course, it developed this scale was developed 1940, 204 in children. Some authors also tried to minimize the effect of such changes by using to do what we call the transition of anesthesia at the end of surgery, where they shifted the sevoflurane anesthesia to propofol to minimize the effect of emergency agitation. Of course, it was shown that there is an elliptic form ECG changes when we use the sevoflurane, which is correlated to, of course, to the concentration of sevo and the time. Both things are correlated to this ECG changes. It was shown, of course, that Lucas ceruleus, which is present in the brain stem, which is responsible for the sympathetic activity, is being affected by this by sevoflurane anesthesia, where the GABA centers take the upper hand, which may explain the causes of sevoflurane inducing emergency agitation. Meanwhile, of course, the analgesic, the narcotics, was proved to affect the alpha-2 adrenergic receptors in the dorsal horn and affecting the substance B. This is one of the mechanisms of the acting of morphine. Melatonin was shown also to have an effect on the decrease in the incidence whenever it's given also at the end of the surgery. And this is a scheme where we make an abbreviation of words where we call it a brain map. This each item must be considered whenever we find a patient with emergency agitation. Sometimes we always use sevoflurane at the beginning of the anesthesia, and then we shift to ISO. This combination had no effect on the incidence of emergency agitation at the end of surgery, but on the other hand, it increased the incidence. You see, and there was no correlation between the link between the sevoflurane and the bispectral index. It was found. Of course, the way of induction of anesthesia has a rule on the post-op emergency agitation, we must consider the way we are inducing anesthesia in such patient. Of course, this agitation may be correlated to central anticholinergic syndrome, which occurs in elderly patients when they are giving too much atropine or scopolamine, where we ought to give them fustogamine to increase the, of course, fustogamine, as we know, it is a tertiary amine. It can pass the blood-brain barrier, where it can increase acetylcholine to diminish the central anticholinergic syndrome. Of course, we have a combination of antihistaminic with midazolam to decrease the incidence, and the dentist, the working physician found that whenever I combine the lidocaine with dextromethimidine as infiltration, increases the incidence. Of course, as we can see, the nasal drops of ketamine given by a special drop. And behind my back, I'm sorry, I cannot change my situation. Where we can see the sinister type of ketamine and the rectus type of the molecules. As you can see, what we call the chair. I'm going to shift my head. You see the how does the molecule look? As if we have a chaise-longue. The chaise-longue is being used in the beach. You see, this chaise-longue is the way how to express the molecule in this 3 dimension. It looks as if the molecule was straightforward, and then we bend it in a special way, so we created what we call the chair. This is why it looks like that, you see. So this is a configuration I want to show you what's the meaning of a chair. So you see, whenever you do draw 2 L's on each side and join these 2 L's with each other, we will create what we call the chair. Of course, what's the meaning of sinister? Sinister means that it is an evil thing by the literally, and on the other hand, we consider it as a left side. So we can call the rectus. Rectus means straight, or which is on the right side, dextrorotatory, and sinister is levorotatory. What's the meaning of rotatory? It rotates the polarized light. You see, whenever I subject polarized light, so each of them will reflect it to one side and other to the other side. What's the meaning of how does we can we differentiate between the 2 molecules? It is by how we count the molecule. So suppose we have counting, we begin with the counting of the molecules by the largest molecular weight. You see, of course, if we have iodine has a very large molecular weight, a molecular mass, so we begin to count on the right side to downwards, or on the clockwise or anti-clockwise. So accordingly, this what makes us call it a sinister or a rectus. This video, of course, I'm trying to show some of the mistakes that we always encountered from our young colleagues. And this site is a very nice site where we can apply different types of statistics. Just put the numbers in it, and it will give you the end result. This is Mr. Anderson, where I began to understand my statistics from him. Really, I appreciate too much for him. This diagram, first of all, shows what's the meaning of normal distribution. Normal distribution is the normal distribution of the population. You see, it ought to be in a bell shaped, as you can see. This normal distribution of the data, where we place the data in a histogram, as we see, in a way, whenever we touch the uppermost part of this histogram, we can draw a bell, as we can see. Of course, we can see from this diagram that not all all of the histograms are filling properly this histogram. So we call it normal distribution. Of course, this normal distribution is capable for us to use what we call the t-test. You see, whenever this normal distribution is skewed, يعني it's lifted to the right or lifted to the right or left, this makes fallacies, you see. So whenever our data can fulfill this normal distribution, we can use what we call the t-test. So this is an area, it creates this area collectively equals 1. Whenever I want to divide it, of course, the uppermost part in this or the climate of this hill or the bill is what we call the standard deviation, or what we call it mu whenever we are using the population study. You see, we always take a sample from the population. You see, it's very difficult, of course, to measure all what are there. So we take a small sample. So the standard deviation, the mean of this sample is being, as we seen, dividing the bill into two sides, equal sides, and we have on the other sides the variabilities, how the data are being spreading all over this bill. You see, so we have different standard deviation. We call it standard deviation whenever we are using the sample study, and we call it sigma, small letter sigma, whenever we're using a sample size. So we have the standard deviation, and we have two. We have a mean in the middle, which represents the most of the data, we will discuss how do we calculate, of course, the mean. And on the other side, the spreading, which is the standard deviation. As you can see, we have 1 and 2 standard deviation. The area between the two first standard deviation, as you can see, is around 68. And the area between the two second standard deviations is around 95. Whenever I want to expand to the both tails, this area is being called tails or alpha. We can say that all this area is around 99.6. Of course, it never reaches to the zero. So the beginning of statistics by the t-testing was administered by what we call Josette. Josette was from Dublin. He was asked by Guinness Barley company to make a different statistic between two fields. You have two fields, 1 and 2. Of course, it's difficult to take samples of all the fields. I don't know how much bigger this population. So he took a sample of each field, and then he drew a histogram, as you can see. So he wants to compare both of them. So these are the yields. He took around 16 and 16 from this side, and he wrote the data, as you can see, on both sides. And then after that, of course, he wanted to share this his idea with other statisticians, but this company, Guinness company, refused. This is why instead of calling the t-test Guinness, Gossett test, it's being called a t-test. He agreed with the company to call it a t-test. So this test, we take the data on one side, as you can see, from the two fields. We have two fields. Of course, this test is called unpaired. Was being unpaired. I'm comparing only the two fields, not. But for instance, I want to be paired. Suppose I want to use a fertilizing element in this field. This fertilizing field in group 2 will make it a pair. So I'm using as if I'm using a second statistic with the group 2. You see, so this is why we call it a paired group. But this study, it's unpaired. It's unpaired. On the other side, it is on both sides. You see, we can say that the study is both side-tailed or right-side-tailed or left-side-tailed. I don't know. The data will go to the right side or to the left side. This is why we ought to use what we call both side-tailed. If I know definitely that the data will go to this side, well and good. If I don't know, it will make a fallacies. In other words, suppose to understand what's the meaning of this two-sided tail. Of course, if I have a medicine to treat cancer, of course, I must put in mind this treatment ought to improve, but who knows? It may worsen the condition. So we may have data on the left side and on the right side. This is what we better use what we call two-sided tailed test. So after taking the data, as we can see, he made he estimated the standard deviation. He estimated the mean. The mean means that you take all the number of the person and divide it by the amount, and then he used the standard deviation and he went to a special equation and he got a number. This number, what we call, is the t-value. The t-value is the value of the number of this data. Of course, whenever it's below 30, we call it a t-test. Whenever I increase it, reaching nearby to the population, we call it a z-test. So this figure he got after the equation was 2.3. So what do we do after that? We go to a special table. This table has, of course, rows and columns. To choose the right point between both of them, of course, we use what we call the degree of freedom. Degree of freedom of both of them. The groups are, we're going to subtract one from each of them. So the degree of freedom will be 30. So I go to the 30 row and with the column of the magic critical value. What's the meaning of magic critical value? In statistician, most probably we use what we call 0.5% or 5 in 100. This is the magic value. So we choose this magic value from the column, and then we attach it to what's on the rows of the what we said before, the degree of freedom. These 2 points are reached. In 1 point. This will give me a figure. If this figure is less than the figure given by the t-value, means that the difference between both collected data of both fields are significant. There is a difference. Of course, it's very difficult to differentiate between which is better, which is the yield more. It's very difficult. So this is why we do the test. Before I forgot to tell you something. We have what we call the null hypothesis, and we have the rejected or the alternative hypothesis. What's the meaning of that? The test means that I want to be sure that there is a difference. If there is no difference, we will find most probably the mean are equal and the variabilities are almost equal. But if there is a difference, we call it an alternative hypothesis, where the means are not equal. So what can make this differentiation? By using the tables, as you can see. Whenever I take this figure and then I compare it by the figure on the tables, as you can see. So this is what we call the t-test. T-test, as we said before, is very beneficial in parametric studies. Parametric studies is the parametric where we can create a normal distribution, you see. But if it's skewed, you cannot create a normal distribution where the data are separated. Suppose we use another test. Now, if you have more than 2 groups comparing, we use what we call the ANOVA test. The ANOVA test, as we can see, it can be done manual, as from this video, in 5 steps. Suppose we have 3 groups, as we can see, and we have the data of them, the numbers, of them. It's difficult to see what is more significant on both sides. You see, so I want you to remember something that what's the meaning of mean? Mean is taking the figures of each of the groups and dividing by the number of figures. You see, so in this ANOVA test, one-way ANOVA test, we have a normal mean. We call it X bar, X and bar. We'll show it later on. This ANOVA test, we have what we call grand standard deviation, where we create a standard deviation among all these groups. Of course, we have a degree of freedom from the three groups. Of course, 3 minus 1 equals 2, and then we have nine figures from the 3. We subtract from them 3, and then we get the degree of freedom, and then we go to a special table. As we can see, we have rows and we have columns, and then the rows and the columns are reach at the critical value, which we had told you before, which is 0.5%, and then we can find a number. This number, we compare it with the number we figured it out. If it is less than the number we created or figured it out, we can say that the data is significant. If it's more, it's not significant. So we shift to what we call the null hypothesis instead of the alternative hypothesis. This is what we call ANOVA test. There are many types of tests, of course, but as we said before, the t-test is suitable for normal distribution, where we can create a normal nice bell. The chi-square test, chi means, chi is, what's the meaning of chi? As we can see, chi it looks like X. So the one of the lines are straightforward, and other one is shifted from the upper and the lower parts. Chi is the 22 letter of the Greek alphabet. This is chi. This is why. So chi-square test. Of course, this is, we call it a sum. It is sigma, but the sigma of this is in a capital word, but the sigma of the standard deviation is in a small letter. So how can we use this chi-square test? It simply is the equation subtracts the observed from the expected over the expected. What's the meaning of that? Of course, if we have a coin and we flip the coin, this coin may give me a head or a tail, you see? So logically, you can say that the end result will be, suppose I'm going to flip this coin 25 times. Logic, you say, okay, it's going to be most probably 25 and 25 tails and 25 heads. But suppose it creates another figure. Suppose we find that it's only 20 head and what we said about 50 and 30 tail. Is it significant or not significant? Or is this coin abnormal, or the way I'm flipping the coin makes the difference? I want to be sure that there's nothing wrong with the coin. So whenever I apply the what I find, whether it is tail, and put it in this area, and then I subtract it from the expected, which, as we said, if we are going to use, suppose to 50 times of flipping, where the tails will be 25 and the expected head will be 25. So I subtract the observed from the 25 and I divide by 25, adding to what I had find from the tail. So I sum both of them, and I reach to a figure. This figure, I go to a table. This table, of course, I reach to what we call the critical value, where I can say that what's the degree of freedom. We have two outcomes, whether tail or head. So whenever I subtract 1 from 2, it's 1. So I go to the special table where I can reach to the critical value. I find a number. This number, I compare it to what I had from the result. If it's less, it will be, if it's less, we will reject the null hypothesis. If it is more, we will accept the null hypothesis. Of course, there are another test used in the study made by my colleague. Levine test is a test most probably for non-parametric test, where of course we arrange the data. I want to be sure that this data is normally distributed. So I can use what we call the SPSS, or we can use Excel or Google Sheet to figure out the end result of this test. To see whether, of course, we use also the null hypothesis and the alternative hypothesis to see whether the data is in a normal distribution or not. This is Kolmogorov-Semenov test. This test is some sort of improving the ANOVA test, or finding more about ANOVA test. So we do an ANOVA test, and then we put the as you can see, this is Excel. We put the figures of the data or the numbers we got, and we go to several situations there, which what we call maximum number, and this number will go to of course the as we say, the rows and the columns where we reach to the critical value, which is 5%, to see whether this value is whether we accept it as a null hypothesis or we reject this null hypothesis. And we have what we call the Tukey test. This Tukey test is, of course, improves also the ANOVA test. It makes me more precise about what are the more significance among the different groups. So this is a figure where we use from the figures, as we can see. We call it honestly equation. And the Cross-Wills test is a test where we compare of the ranks instead of the variance. What's the meaning of ranks? Ranks means that I am, suppose we have a sample. This sample we have 5, 6, 10. Suppose I arrange this bigger numbers by the ascending or by ascending. That means that the smallest takes 1, and then the second one takes 2, and so forth. So this is what we call it ranks. So it is a figure between two ranks. Of course, what's the meaning of the P? As we can see, the P value less than 5% means that the null hypothesis is rejected. You see, and this is how we gain the standard deviation. I'm sorry. What's the meaning of degree of freedom? Of course, the degree of freedom, in other words, means that I am I have a limit to figure out things. In other words, suppose I have the number 10, and then I had 2 figures after the 10. Suppose 2 and 7. So 2 and 7. Whenever I sum adding to each other, give 9. So I don't have except adding 1 more. I cannot add 2 to give the final 10. So this is what we call a degree of freedom. I don't have enough freedom to choose the last number. As long as the total number is 10, and I had 2 numbers, 2 and 7, which is 9, I cannot use more than an additional 1. So there is a difference between the degree of freedom, whether I'm using a large number or a small number. These are the point. What's the meaning of a parameter and a sample? Of course, statistics. What's the meaning of statistics and parameter? Parameter is as you can see, the data taking from the population. You see, it's standard deviation in the sample, we call it X bar. But whenever I'm using a total population, we use mu, and so forth. So this is a hint about some statistics knowledge. Of course, it is a big subject. I hope that you, I had encouraged you to enter to the YouTube to find out more. والسلام عليكم ورحمة الله وبركاته.